Good afternoon, everyone. I'm trained as an economist and a statistician, and my work is designed to leverage data and statistics to guide infectious disease policy. I vividly remember the last class I taught in person before going into lockdown, before the pandemic. We knew the pandemic was coming our way, but we didn't know what that was going to mean. So I decided to teach my graduate statistics class two very technical mathematical concepts to help them make sense of what was going on. And I was pretty surprised when about a week later, I saw all of my friends sharing these same two concepts on social media. And I'm pretty sure they're familiar to all of you as well. The first is exponential growth. This tells us that a small number of cases can quickly grow into a major outbreak. And the second was flatten the curve. That showed us why slowing transmission was important to make sure our hospital systems were not overrun. These two examples show the value of math for understanding pandemic policies. Math provides a powerful framework for making sense of what we can see and what we can't see. Amen. It helps us predict the future so we can make a plan. And it also helps provide evidence for some policies that might seem very counterintuitive. We learn when studying exponential growth that the optimal action often looks like an overreaction because cases are growing so quickly. It tells us why it's important to prioritize the elderly for vaccination, even if that might slow the vaccine rollout down a little bit. It tells us that we should be paying people to get vaccinated to make sure our vaccination rates are high. And that we should be using inexpensive rapid tests in addition to lab-based PCR because they're better for controlling transmission. So one big challenge working with mathematical modeling is that it risks being out of touch with reality. So I try to make sure that my work is grounded in the real world. Before COVID, I worked on two other infectious diseases, HIV and tuberculosis. And I spent a lot of time traveling to places like Africa and India, where I followed doctors around as they treated patients in healthcare clinics and in hospitals. And I spoke with lab technicians about how they interpreted the results of diagnostic tests. And I met with an awful lot of patients. I took a lot of notes, and I asked a lot of questions. I asked things like, what are your biggest challenges? How do you make decisions? What information do you wish you had access to? And then all of these conversations helped me formulate the goal of my research, which is a policy question that needed an answer. And then I would find available data and needed to build evidence to be able to answer that question. And it wasn't always easy. I often had to build a bridge between the data that we had and the question that we needed an answer to. Math to the rescue. The bridges that I build are based on statistical methods, they're based on mathematical models, they include real-world insight and a big dose of creativity. But what does that look like in practice? Let me tell you about one of my projects on drug-resistant tuberculosis in South Africa. Drug-resistant TB can be complicated to diagnose. The tests can be unreliable, and they're often not even performed because of budget constraints. So that means a lot of cases are going undiagnosed. There was one data source available, and it was of questionable quality. So I needed to figure out how I could leverage that data to answer this important question and figure out how many cases were going undetected. So I took 3 different statistical methods, combined them together, and adapted them for this specific purpose. And we were able to find that 20% of all drug-resistant tuberculosis cases that were already in health facilities were going undetected. 20%, 1 in 5. So we managed to leverage this questionable data set, this data of questionable quality, to produce compelling evidence that healthcare systems needed to figure out a way to start testing a lot more patients. Now I work on COVID-19, but I'm still really worried about cases that are going undetected. Rapid antigen tests are a really powerful tool for helping us detect cases early, and we should be using them a lot more in addition to lab-based PCR testing. Rapid tests have several advantages over lab-based PCR. They're designed to detect infectious cases. That means cases that are at risk of being transmitted. They're available at home, so that means more people can get tested. And you get your results in 15 minutes, so we can catch cases a lot more quickly. They're pretty inexpensive, which means we can test a lot more often. And it turns out that frequent testing actually more than makes up for any decrease in accuracy from these less expensive tests. We want to think about how rapid tests can be powerful. Let's look at the math. So here we're thinking about all of the infectious COVID-19 cases. These are cases that are at risk of being transmitted. Rapid testing, we understand, identifies about 95% of those cases correctly. So 95% are going to get that positive result. But that means 5% of them are going to get a false negative result. That means they're going undetected. That's not a good outcome. Can we do anything about that? It turns out, if we do the test over again the next day, then 95% of that 5% get the correct positive result and are detected. And that leaves us with just 0.25% that have a false negative and go undetected. So we can use frequent testing to make up for the accuracy issues. And what we want to do is make sure that rapid testing is widely available to everyone. Our current president understands that and has allocated just this last week $1 billion to buy rapid tests. We want them to be easily available to everyone. We want them to be inexpensive or free so that we can test frequently and keep cases down. The beautiful thing about frequent testing is that we can boost a test that has 95% accuracy rate up to a 99.75 accuracy rate just by testing a second time. Decision-making that combines real-world expertise with insights from mathematical models can be really very powerful, and it can be the key to getting us out of this pandemic. I want to leave you all with one final point, and it's about the most simple mathematical calculation of all. When it comes to slowing transmission, every little bit of effort makes a difference, no matter how small, because it all adds up. If we can work together, we can make it nearly impossible for the virus to spread, and we can put the end of the pandemic within reach. Thank you.